our plan and our willingness and interest to make this stupendous CoWIN platform available as a digital public good to any countries who may want to use it for their purposes. Now that we have gone through a detailed presentation, this is a time for any questions for you to raise that we could answer. So let me just share some hygiene factors how to address this question answer session. If there is any question that you would like to take up with us, please raise it in the Q&A part of the Zoom platform and not in the chat. And then we will take up each of these questions and we will address that. If there is some of the members of the delegates would like to raise the questions in any of the 6 languages that is for which we have translation available, that is also welcome. My colleagues will make arrangement for it to be translated and made available for me. So to one request I would like to make to you is that whenever you write a question, after the question, please write your name, your organization, and the country from which you come from, and most importantly, your email ID, because we intend to share with you the answers of the questions that has been addressed today, and some of the questions that have not been also answered because of the time availability. As you heard my colleagues explaining that we have planned for about 1 hour of question and answer session, of which the major part will be taken up for CoWIN and the remaining part would be taken up for the NDHM part of it. So if you are unable to answer any of the question that is raised today, or if some of the answers have been too limited, we will arrange to send you the answers to all the questions. So to begin with, I will highlighting some of the questions that were already raised, and that will be answered by my esteemed panelists who are present here. We have from the CoWIN team, Mr. Devaprabha Naik from NEGD, Mr. Chalukya Mohanraj from Trigen, and Mr. Vikas Tiwari from Amazon Web Services available with us to answer any queries with respect to CoWIN. And and after we take up the questions on CoWIN, we will arrange to have the questions related to NDHM. And there we will have our Dr. Praveen Kadam, additional CEO, and Abhishek Kumar, Executive Director, available to answer any of the questions. So while you are probably placing your questions onto the on the Q&A platform, let me try to get you answers to some of the questions that has already been raised. The first question that was raised was that, can you make this certificate that is already generated available in any of the third-party applications, travel applications, so that it can be used to prove during their travel anywhere in the world? So Mr. Naik, would you just explain how this can be a verifiable, this certificate generated can be verified by multiple applications anywhere in the world?
I think that API is available, also that you are providing the verification services through our portal, so that you can, who wants to verify, they can verify using our either APIs, or they can use the console services to verify the certificates.
There is a popular demand that I can see in the question and the session, that whether we will be sharing the Q&A, sharing the text that had been used for the presentation. And our team has explained that they will they will make it available to all of you, maybe as a part of in our website, with our links being provided for you to enable for easily download. Mr. Naik, the next question that is coming to you is, will you be sharing the source code also of this platform that will help us to do customization beyond the configuration that you have provided for?
I think that code will be open to the that countries. Those are being with the MOUs, and definitely they can do whatever they want. They can add their own modules. We are having the basic set of the APIs. They can add whatever they want to do. That code
Uh,
base will be the countries. I think that will be open to the code base will be open to that particular country.
So, do we have to have sign any licensing agreement or any other agreement with the government of India to make use of this software, or is it available as an open source software?
No, that it will not be open to the public. It will be open to the particular country.
Okay. Can we also arrange to have some system integrators from our country to do the customization? So, and will you arrange to give them some training on the platform that you've developed so that they can do an effective customization for us?
We are open to that. I think that any companies are interested, they definitely show their interest, and definitely the technical team will arrange a technical session with them.
Are you also planning to make available a panel of system integrators from whom we can choose if we do not have any such integrators in our country?
We are open to that. We are open to that. Let's have that any companies or any SIs are being interested to work with us, then we are open to that also.
I understand that this is a very evolving software. Will you be making the any software upgrades that you make? Will you make continuously making it available for our usages if we decide to use that?
We'll continue to do that. If there is a new versions will come up in the Indian version, and also that we can either co-merge with the international version, either vice versa. If something is good in the happening in the international version, then we'll merge with the Indian versions also.
Uh, Will you does it provide how extensive analytics module do you have you provided with the Coven application for us to make extensive data analytics on the data that is being available, and to what extent of granularity you database all the events that takes place from from
Except
registration.
Okay, that except personal data, that identity, that others granularity is there to have the analytics top of it. Yes, for the Indian context, we have the extensive already the dashboard having the extensive analytics. If any country wants to build top of that, also they can build it.
Do you have a deduplication facility available in the system that if same person try to register multiple times, will you take care of that?
It is right now available as a part of any ID or the person being using that. I think we are making it as a mobile number, name, date of birth, gender, as well as the ID card. So in the current system, yes, that mobile allows the 4 persons to be registered, but in the ID card basis, we can uniquely identify that the deduplication should be stopped from that basis.
Do we have a, can you just describe how does the verification process of the vaccine certificate operate?
Okay, that are the APIs are all available. That is the APIs are available whether the person is vaccinated or not, that we are providing as a part of COVID. Plus, then the vaccination module also, if there is a printable certificates, you can verify through the QR scanners. If you don't use the APIs or something, then you can also verify through our console program that the scanning through our any desktop or mobile having the cameras, so you can scan that and you can verify the certificates.
You know, sir, do we have you know, we might have already initiated the many of our vaccination program, and many of the data may be already available in the system. Will it will Coven allow for upload of historical data if we take it up later, or will all
It provides that the new
how do we handle?
that a new vaccinator module, so we allow that as a part of, if you have vaccinated, they can upload to the systems, and that can be certificate can be generated on the basis of their vaccination. Some parameters we are taking, and on the basis of that, certificate can be generated and verified.
There is somebody has raised the hand. Is there? And there is, one of the question that was raised. I'm interested to see how you would address an ecosystem that is technology handicapped, poor network coverage, limited access to internet, and so on and so forth, and low utilization of smartphone. Can you just explain how you have addressed these challenges in your country with a digital platform like this?
I think they can build only the digital database. They can upload their data, whatever the way. I think they can only use the one module. They can build a digital database. Most probably, they may not require to do a registration, online registration, or other things. But they can do something backlog data. They can enter into the systems and create a digital database of the vaccination program.
Have you also? Is it also? There's a question from the Vietnam embassy. How can we get this application made available to us? Earlier in the presentation, we had actually given a detailed procedure of how to get this application available to you. In terms of the first step that was explained was that you should contact our embassy available in your country, and then they will contact our, the ministry here, who will arrange for a MOU. And after that, all these things can happen pretty fast. Then we can make available the whole, based on the agreement, we can available for the code set and the application. So you just need to contact our, the Ministry of External Affairs or the embassy locally available. I think then these things can get moving on that. Do you have any unique identity you consider to identify duplicate registration? How do you do you give a unique identity to all the people who are coming in for registering themselves?
Yeah, true. We are providing a registration ID. Those are registering into our systems.
We have a question from the Republic of Congo. Would like to know the cost of sand holding support from India if it wants to use this platform. Earlier we explained to you, if there is any clarification or support needed, they can reach across to us. And plus, we have also we will be empaneling a number of service providers who will be able to extend extensive services with whom you will be able to directly negotiate and fix up a charge. And in case you would like to, as it was explained earlier, by Mr. Nayak, in case if there is any system integrators or software developers in your country who have already will like to do this integration by themselves, you could reach across to us. That is reach across to us, and we will give them the training. It's a very, very important question that has come. Is that, is the data stored on a cloud, or the country can utilize their own system?
It is a purely designed for the clouds. Anybody can take the cloud service provider self, and they can deploy our applications. And also, if they are not willing to go for cloud, then the system needs to be customized for to deploy on premises.
Okay, so Mr. Naik, you're saying that if a country needs, they can do it, implement it their own data center, on-prem data center. They can have, or they can, if they are using any cloud services, they can have their own choice of cloud service provider under their conditions to use, so that it is not married to any particular cloud
It is not marrying, but
applications.
if it
Is
is
it
the
can,
AWS, if it is the Amazon cloud services, it is easy. It is the template wise. They can move as a part of just a copy paste solutions. If that it is not AWS, then some customization will have to do if the for other cloud service providers. Yes, we are being into open architecture, open standards, and open source. So that is a little bit of customization required on the basis of if it is the Azure or Google clouds. Or if they go for a on premises, then they have to do some customization for that.
we have a question from Mr. Felix from Central PEV of Congo saying that can we already have an existing platform? Can we migrate our existing data? Mr. Naik has already explained that that is a facility through API will be made available so that you will not lose any data. Is there anything further thing that would you like to add, Mr. Naik?
No. They can straight away migrate the data that APIs are available. If there is the only 8 fields data, they have to migrate to the Covin architecture. They can do either through a upload program or they can do straight away the migrate through API only.
We have a question from Ji Soon Song. It's asking that you had explained that this is has multiple modules. Uh, uh, um, how the authenticity of the data ensured backend modification is allowed, I assume, from your answer on the possibility of loading existing vaccination record. His concern, Mr. Naik, is that if you are doing backend update of data, how are you ensuring authenticity of data?
Okay, that our certificate module that guarantees that whole authenticity of the data is the transaction modules like vaccination or appointment or registration. That only a transactional way. Yes, that our certificate module gives the authenticity.
So if I just understand correctly, Mr. Naik, what you're saying is you have provided for backend upgrade of the transaction data under very strict authentication requirement that is trackable, auditable authentication mechanism. But the certificate data is immutable, irrevocable, and non-changeable. And so because of that, that data is, and every vaccination certificate data that is generated will be absolutely secure and stored in such a way that authenticity is ensured. Is that what
Yeah,
you mean,
it's
Mr.
true.
Naik?
It's true.
Can we use only the program that we need? For example, the certificate module, or do we have to use a complete platform total?
No. It is totally module by module. If they want that, okay, they only required only vaccination module, or they only require the both to vaccination and certificate module, they can do. If they want that, okay, they want to registration and appointment, then vaccination, they can take a total, or they can take some modules like certificate straight away. They can take a certificate module directly also.
There is a question that came while rollout of vaccine in Africa is still quite dependent on Covaxin as well as stunted to a certain uncertainty raised by the reluctance of the EU to accept certain vaccines. Thus, reluctance for many in Africa to accept the vaccine itself. Could the Indian government help with the supply chain as well as governments that sign up for the CoWIN platform? This should help African government plan rollout. I think this is also certain policy implication with respect to the vaccine, and that is definitely something that we will, will have to take up with our health policy as well as the policy of international collaboration part of it. What we will do is that we would, give a more detailed answer on mail to you. Okay. Another question that came is, how do we provide for any rectification of discarding of any registration if person by mistake entered, some mistake at the time? Do you provide for cancellation of registration?
But recently we have added that the new module that is called the grievance or help desk module. They can raise an issue on the basis of the correction of their name or their identity, or they can update their identity card with the passport number. So there are the different modules on the basis of our knowledge, our experience we are adding to this. And I think that can be another module, another type of grievance will be definitely what the people are facing, and we will definitely modify that module to take care of these are the things.
Today, each country has COVID-19 vaccine platform. Is it possible that COVID incorporate these platforms uh, uh, of incorporate all this national platform? What are the advantages and challenges if it is possible? Maybe they are asking, whether we can integrate with the existing platform, with that. So I will just add a point, and then, if they have a vaccination management platform and you want to use this migrated to COVID, it is possible. And as Mr. Naik explained, the very powerful certificate facility that is available, which is now internationally, recognized, is something of the functionality that will be a very, very useful for, especially when it comes to international acceptance and of the certificate issued by the authorities. Is the platform GDPR compliant? What are the means to ensure security, privacy of the data? Uh, Mr.
Mr.
Naik,
Koshi,
would you like
I would like to add on this
Chalu?
that this
Because
has
Yeah,
been,
Vikas.
yeah. So this platform has been developed using the services which are all compliant for GDPR. So the underlying platform, the databases, the Kubernetes environment, they all are GDPR compliant.
And we do not store anything in cookies. So yeah, as rightly said by Vikas, we are GDPR compliant.
I think answering that, Kosi, your the first question, that why COVID is required or not by the other countries. I think we have built a platform that knowledge that it is a largely scalable platform, right? It is the 9 million vaccination in one day. So it is a largely, you looked at, is a much more scalable platform as well as modular also. That platform can be scaled to any type of vaccination in future. So that is why that we built it in such a way that API-based approach, and that the third-party application providers, they can easily integrate with us. Now that in India, we looked at how many third-party application providers are being integrated with us. So that is where that either they looked at the architecture, or they can take the knowledge from the COVID, how we built it, or they can take the application altogether.
Let me just also share with you, while we had been trying to answer this question that is coming now, I'm sure when you think about it, there might be more questions coming. So we are making available extensive documentation of this platform, videos of how to use this platform. All this is going to be available, and after you express your interest, we will make all this complete set of documentation, videos, and support document available. And Mr. Naik, as Mr. Naik explained, if there is still any kind of hand-holding or support that is needed from our side, we will make arrangement for that. And we are also make available a panel of system integrators whom you can have enter into a contract on arrangement with them to give continuous support, as well as if you have your own software providers or system integrators taking this up in your country, we will provide a necessary training and documentation for them, and that's a kind of support that we have provided. Let me also share with you that you have heard the presentation on National Digital Health Mission by our team from NHA, headed by Dr. R. Sharma, with additional CEO, Mr. Dr. Praveen Gadam, who has been here. So if there are any questions you would like to raise on that one with respect to that, we'll be happy to do. There are a couple of questions coming. Dr. Praveen Gadam will address. So before that, I'm sort of I'm sort of waiting for a few seconds to see whether there are any particular question you would like to raise on CoWIN. Otherwise, as I said, if there is anything more, kindly send a question, raise your questions, and give from which organization and what your name is and your email ID. We will share that with you. Or when you come to our CoWIN landing page, you would see a particular in our portal. You would see particular pages giving you the details of how to contact us and how to get a variety of documents and product information available. So if there is no further questions on the CoWIN, may I request Dr. Praveen Gadam also being available for some questions on the NDHM.
Yes, Mr. Koshi, I hope I'm audible.
You have made a fantastic presentation of your vision of what you are going to develop as a national digital health mission and the digital infrastructure you will be building. A question is that, are you also developing, as you've done in terms of CoWIN platform, will you be developing a sort of large-scale platform or even digital components which also may be available in open source like you've done for CoWIN, for other countries to maybe learn from and adopt from?
Okay. So one has to understand the basic concept of NDHM. There are two major types of modules. One is core module, which will be owned, operated, and managed by the government of India. These will be unique. And these modules consist of registries, which provide single source of truth with respect to identity of a doctor, hospital, and a patient. Now, on the top of this, we will be allowing any number of applications which can ride on the top layer, if you remember that stack diagram. So what are the most important user applications that one can think of? It can be search of particular doctor or hospital based on certain parameters such as specialty, language, geographic location, and so on and so forth, and getting connected to that, and then seeking teleconsultation, selecting a medicine out of various options and getting it delivered, getting a lab facility. And also particularly for hospitals and laboratories, one can think of hospital management information systems, HMIS or HIMS, which will create records which will get linked with the health ID, enabling to pull record of a particular person from various different types of hospitals using different types of IT system. Now, these are the reference applications. We intend to create some of them, not all, and for rest of it, we expect that the vibrant IT industry of India will take the initiative and develop various innovative solutions as per the requirement of users. As far as government reference applications are concerned, we will be hosting their information on the public forum so that people can also use them. I hope that answers the question.
Yeah, that is very valuable input, sir. The question, related question coming is that you said that you may be making some reference application. So that means that for the smaller hospitals and facilities who may not have their own digital sophistication, they will be able to make use of this reference application without any fee being paid to government, etc.
So we will be making reference applications either free or at minimal costs.
You explained about a possible international collaboration. It was a very interesting idea because the total digitization of the health is a big challenge, and we are all trying to fathom the implication of this. So are you thinking about some kind of a collaborative forum where many countries can participate and possibly do knowledge sharing on a periodic basis?
Yeah. So when it comes to international telemedicine platform, probably the most important element will come in the form of identifying the correct genuine doctor or healthcare provider. And this responsibility, as far as India is concerned, will be taken by Government of India. Every single doctor and hospital which you can see on the platform, that is MDHM, we will be verifying it that the person is actually a registered doctor with required qualifications before onboarding him on our platform. And that is how the patients getting connected from outside India will be able to have that element of trust. Now, when it comes to the reverse kind of scenario, when Indian patient wants to consult a doctor in any other country, the other country, we will be requesting them to provide similar kind of mechanism to ensure that the doctor who joins the platform is actually verified by certain entity, some authority, so that the person getting connected to him from any other country should be confident that he is talking to a doctor rather than anybody else. I can see more some more smaller complexities as we consider collaboration between different countries. One can be language barrier, which can be overcome by necessary tools for translation or some assistance. I can also see an issue about availability of a particular type of drug or medicine, different names or brand names used in different countries, and that may require some case-to-case tweaking when it comes to two-nation connectivity through telemedicine, but it is perfectly doable. A lot of people are doing it even now through various modes, but what we plan to do is a sort of institutionalize this international telemedicine platform.
Are you creating a sort of longitudinal health record, integrating the data from multiple hospitals and labs and so on and so forth? In that case, how are you handling the permission, especially with taking care of the worries of privacy and so on and so forth?
See, I go back to one of my earlier slides of my presentation where I discussed the basic principle, that is federated architecture. Except for the core registries, nothing will be stored by the Government of India server. The data about health will reside where it is residing right now. What we are doing is only connecting all these different systems with each other. The data from hospital X will remain with whatever system that hospital X is using. Now, having said that, a patient, say Mr. A, his records are available in 3 different hospitals X, Y, Z. The records will continue to reside in these hospitals X, Y, Z. The patient will be able to pull the records in his mobile or in his laptop or in his tab, in his app, a locker or a wallet, because of the unique identity, that is health ID, and only he will be having that particular longitudinal medical history in his wallet or in his personal health record app. Now, when he goes to any other doctor for any consultation, then he can give access to his record digitally by various means, and that becomes available after consent to the doctor. So the question of compiling all the records at one place to create longitudinal medical history doesn't arise except for the purpose of health locker, which will be stored only on his mobile and not in any other system. So that is how the architecture is, and this ensures the privacy and confidentiality of very high level. Second, we have this element of electronic consent manager and health information exchange, which ensures that the data is shared only after the consent, and all the other necessary legal and technological tools which are required for ensuring the privacy and security, they are in place, and we are trying to make this system very, very confidential, private and secure.
Sir, you have explained in detail your vision as well as the strategy Are these available in some sort of a public document that is we can access and understand, or is it a
Yes,
confidential document?
I know certain, obviously, certain policies pertaining to how we are ensuring security, etc. These are private, but most of the documents are in the public domain on our website, that is ndhm.gov.in. So anybody who is interested in understanding the further technicalities can go to the website and read whatever is there.
Sir, one thing that comes to my mind is that when you have such a powerful digital infrastructure, it is also opening up the possibilities of aggregation of data, for doing analytics and to sort of do policy making on one side, and possibly such data, if made available, if there is a possibility for data sharing for third parties, probably with certain security policies, it can also lead to a lot of medically relevant research to be done. Are this part of your larger strategy, and have you provided technological enablement for these elements?
Yes, so we don't want to have data without using it. Obviously, data is a new gold or new oil, as they say. So we will have this option of using data for research and development, for analytics, for monitoring and evaluation, open, but again with the consent of the patient. When his data is collected, that additional consent is taken, that this data will be used, number one. Number two, when it comes to policy making and such other purpose, we will be using only aggregated and anonymized data, which will take care of the privacy and confidentiality of the person, and it will be used only in that fashion so that relevant decisions in the public policy and public health can be taken.
Sir, are you using the open source tech stack as a building block for this elements and platform, or will you be using any other specialized software applications or platform?
Yes. So if we see general approach taken in NDHM, in general, our focus is on using open source stack. However, coming to some specific components or areas of tech where there may be issues related to availability of robust open source technology, only in those areas cost product option may be explored. So as a general principle, we are using open source products and technology only.
Now that you have thought about this integration, possible integration of the health records across the country, how are you seeing the response of the various private sector players and their comfort to be a part of this kind of a system where they are expected to share their data on the request of the beneficiary? Do you feel any kind of active support for that, or do you have any special policy interventions on that, sir?
We have an experimental space, that is a sandbox for integration of various solutions, both from public and private sector, into the NDH ecosystem. And I am very happy to share that even during the pilot phase, even before the national launch, we have more than 400 public and private digital health solutions which are in the process of getting integrated. And I am very happy to share that the digital health industry and digital health solutions from both public and private sector have shown great enthusiasm in coming on board and joining this mission, that is NDHM.
Thank you, sir. It has been a fantastic set of questions that came, and you have given very, very detailed answers. And we hope that we will have opportunity in future to have them blessing and support for you and your team for this consultation in future, where we can see an international collaborative learning and the build-up of such infrastructure. Thank you. I don't think there are any more questions. So, let me leave it to the organizers to express their vote of thanks to this, the large set of audience and dignitaries who have assembled today here to understand the initiatives that we have taken and be a party to the larger global initiative of making digital public good available in the health sector, and our contribution in this manner of making our CoWIN platform freely available to any country who would like to have it. Thank you.
Thank you very much.
Thank you. Thank you so much to all our panelists, and thank you, Mr. Koshi, for moderating the Q&A section with such brevity and vigor. Before we conclude, I would like to express my deepest gratitude to all the dignitaries and speakers for their valuable contribution to the global conclave. My deepest appreciation goes to the thousands of participants who joined us from across the world and helped to make today's conclave such a successful event. This is not the end, but just the beginning of a larger collaboration. On that positive and hopeful note, we now conclude the CoWIN Global Conclave 2021. Thank you once again and have a great evening ahead. Thank you so much.